All right, so I want to end our section this week by introducing you to traditional Chinese medicine. And I want to do that from the perspective of food as medicine within this system. But to start that, I need to tell you just a little bit about what traditional Chinese medicine is. And we will come back to this at a little bit later time in the program as well, so that you can see some of the treatments that are utilized in traditional Chinese medicine, like acupuncture, and what's known about that. So, traditional Chinese medicine is a complete medical system. It's been practiced for over 2,000 years, and it's based on this Taoist philosophy of yin and yang. So, you've probably all seen the yin yang symbol. That's up here, looks like the two fish chasing each other's tail. One is black and one is white. And then you see a small circle of black in the white and a small circle of white in the black. So with the Taoist philosophy, there actually is a starting place called the Wuji, which is the emptiness. This moves into the Taiji, which is the potential for all things. And then the potential for all things splits into the yin and yang. So it splits into the two things, and then from the two things come the 10,000 things. So everything else in the world essentially comes from the yin and the yang, right? And so that is the Taoist philosophy, and traditional Chinese medicine has kind of overlapped this Taoist philosophy onto medical practice and human health. Right? So this may seem pretty esoteric, and honestly, it is quite a different way to kind of think about the human body. I think it has a lot of interesting features to it. It also is difficult to fully understand and articulate into English. So it's a lot more complicated, I think, than you realize at first. At first, you're like, oh, this sounds pretty simple. But then you get into some of the diagnostics, that a doctor may come up with, and you're like, I have no idea what he's talking about or what he means. Or she, what she is talking about and what she means. To start, yin and yang are essentially opposing energies within the body. So you can think of things like soft and hard or weak and strong. These would be kind of opposing forces. They're opposing forces that can't exist without each other. And that's what the little coloration in the yin yang symbol is about. There's always a little bit of yin in yang, and there's always a little bit of yang in yin. Right? You can never have the ultimate strong person, for example. There could always be somebody that's stronger than they are. They may be the strongest currently, but eventually somebody else might be stronger than them. Same with somebody who's very weak. There could be somebody who is just a little bit weaker, right? So there's just a little bit of yin and yang and yin. So, and it could be anything. Up and down, left and right. Within the body, it can be the energy flow within the body. So one of the major concepts then in traditional Chinese medicine is that you have these opposing energies within the body, or energy movements within the body, that when they're maintained in a balance, they will positively affect your health and you will have an overall healthy state. However, when these forces are out of balance with each other, this is when disease or illness can take hold. Chinese medicine is really focused on maintaining harmony within the body to maintain optimal health. So within human health then, the energy of the body in Chinese medicine is known as qi. And so the qi flows through these defined pathways within the body that are called meridians, right? So you may have seen some of the acupuncture meridians. These are the same energy meridians that are described for all of traditional Chinese medicine, but the acupuncture meridians are where you find acupuncture points for that treatment modality that's commonly used, and we'll talk about that further. But within the body, you have these meridians that have been extensively mapped over these 2,000 years, and they're divided into both yin and yang categories based on the flow of energy either away from the body to the extremities. These are the yang energies, or when the energy is flowing back into the body from the extremities, this is the yin energy that's returning to the center or the core. So you've got this energy flow going on through the body. It mirrors the blood flow also in the circulation inside the body. And so Chinese medicine also talks about blood flow in the body quite a bit. But when the qi energy and the blood flows freely, but not too forcefully, this represents the optimal health status. However, if it's blocked or it flows too forcefully or too weakly, this is when you can have diseases start to take hold or root, or you may have some sort of illness caused by a virus or a bacteria. So the goal of the TCM treatments then is to aim to reestablish this balance and harmony between the energy movement in the body and the blood flow within the body through the organs. If you went to a traditional Chinese physician to receive a medical evaluation, what do they actually do? So they base their diagnostics on the physical presentation of the patient. So this is similar to what would happen if you went to a doctor in the United States, right? He's going to ask you about how you feel. He's going to ask you if you've had a fever, if you've been sleeping. He's going to listen to your heart. He's going to look at your eyes and your tongue and your throat, and he's going to look in your ears. A traditional Chinese specialist is going to do similar things, but they have some features that are much more detailed in their observational skill set than we have in Western medicine. And so they've been able to use these details to more finely determine different types of disease states. And I think they have just more categories for things that can go wrong with you than we have in Western medicine. Like if I have asthma, and I do, I would just be put into one category, right? I have asthma. And we might have some designations to say, oh, it's exercise-induced asthma, or it's asthma that occurs mainly when I'm sleeping, or due to smoke, or something like that. But there may be like 15 or 20 different categories for asthma, and one doctor giving me what would be translated to asthma in English, another doctor wouldn't consider asthma at all. He would consider it a completely different disease that might not be linked together. So trying to put the backdrop of Western medicine on top of traditional Chinese medicine has been really challenging because the diagnostics are so different. So that's been a challenge because the treatment strategies are also different than if you get diagnosed with a different type of asthma than another person who also has asthma, but it's a different type in Chinese medicine. The treatments might be completely different. So the systems are similar in some ways, but they're really a lot different in other ways. So TCM typically will have very patient-centered diagnostics. So they're very individualized for the specific patient. Unlike in Western medicine, if you come in and you have heartburn, that's what they're going to tell you have, and they're going to send you out to go get the Tums and try the Tums first. If that doesn't work, then you'll be ramped up to the next level, right? But heartburn is heartburn, right? But if I'm diagnosed in China by a TCM practitioner, my heartburn might be very different from somebody else's heartburn based on other characteristics that I'm showing. And so my treatment might be very different than another person that also has some form of heartburn. So the diagnostics are very individualized and they include special attention to pulse diagnosis patterns, the presentation of the tongue. So they have a lot of diagnostics by looking at the tongue, and there's other diagnostic features as well. So looking at the skin color and tone, your hair, base of the nail beds, things like this that they are evaluating when you come in for treatment. So this is just a diagram that shows you how complicated the pulse diagnosis is. It's not just like, do you have one or not? You can have a lot of different diagnostics in here. You could have a rapid pulse, a superficial pulse, a deep pulse, a slow pulse, a forceful pulse, a slippery pulse, a thready pulse, right? So you've got all these different categories. And you can have a difference between the right and left hand and the different organ systems that they indicate or go to. So very complicated to learn traditional Chinese medicine, just like it's very complicated to learn Western medicine. Turns out people are complicated. All right, and this is just to show you some of the tongue diagnostics that they would be looking for when they're looking at the tongue. So that is the strategy behind some of the philosophy of traditional Chinese medicine. That was only a tiny introduction, really. And then a look at the diagnostics, how a practitioner would try to diagnose a patient. And then there's different treatment strategies. Once the practitioner has said, okay, I've found the problem. Now to fix the problem, we're going to do A, B, and C. And that's going to be a very individualized treatment strategy for that specific patient. And one of the things that's going to be on that strategy 90% of the time is the food that you're eating. So for traditional Chinese medicine, each bite of food sends nutrition to a corresponding organ. So for example, sour food enters the liver and helps stop sweating and eases coughing. Salt enters the kidneys and can drain and purge and soften masses. Bitter food enters the heart and the small intestine and helps cool heat and dry any dampness. And spicy food enters the lungs and large intestine and helps stimulate appetite. Sweet food enters the stomach and spleen and helps lubricate the body. So it's important to have each flavor somewhere in the diet, and the amounts that you get of each are also important. And so what are those amounts? They're going to vary for everybody, very individualized. It's going to be affected by your body's construction. You know, how tall are you? How much do you weigh? How old are you? What's your sex, etc. It's also affected by things that are external from you. Things like the season. Is it rainy out? Is it cold? Is it hot? Is it humid? Is it dry? These are going to have different pressures or effects on your body. And so they're going to dictate what types of food that you need to eat to help counteract the stresses that are currently going on around you. It's also affected by where you live. So one size does not fit all. Typically, I think it's affected where you live because of the foods that are available in that area. So China's a big country and there are lots of different varieties of food all around the country, kind of similar to the United States. There's lots of different food styles in different areas of our country as well, but even more so, I think, in China. So I've been to China 4 times now. A couple times I've been able to bring students with me to study aspects of traditional Chinese medicine and work with traditional practitioners. And so one of the things that I have is asthma that I've told you about now. And so I've talked with the practitioners there. And after they evaluated me a little bit more, taking heart rate and things like that, they told me to take in foods that support the lungs and the immune system. And so these include things like radishes, rice, mustard greens, oats. And then they really stressed fresh ginger, horseradish, and garlic. Those three spices I'm supposed to add into my diet regularly, especially in the winter when it is going to be cold and rainy and damp. Like those are going to be the harder times for my immune system and for my lungs in particular with the asthma. And so those spices are supposed to help my lungs and my immune system function based in their system. You'll also see cruciferous vegetables are on this list, things like cabbage and broccoli and cauliflower, apples, all mushrooms, watercress, sweet potatoes and yams, and herring, which is not my favorite, but it's not terrible. All right. So this just gives you an idea of how complicated some health systems are and how personalized they are and how much they have broken down how food can be used as medicine. So I don't think we have done that detailed of a job within our country or within the Western societies, like eating food. I don't think we've really uncovered the value of using food for medicine the way it has been in other traditional societies. So this includes TCM that we've had the example of here, but this is also true for Ayurvedic systems in India as well. And we'll talk a little bit more about Ayurvedic systems in a few weeks. All right, so that is it for this week.